बहुत बहुत थैंक यू आज के सेशन में ज्वाइन करने के लिए, पार्टिसिपेट करने के लिए। तो हमारे स्पेशल गेस्ट, हमारे गेस्ट स्पीकर वाईटी 10 मिस्टर वाईटी 10 सर भी ज्वाइन कर चुके हैं हमारे यहाँ पे, हमारे लिंक में, हमारे सेशन में। और उन्हें वेलकम करने से पहले आप सभी लोगों को मैं पूछना चाहता हूँ, यू ऑल आर रेडी? एवरीवन, आप सभी लोग रेडी हो? तो अगर आप रेडी हो तो आप लोग यहाँ पे जो हमारा चैट बॉक्स है वहाँ पे आप यस या नो टाइप टाइप कर सकते हो। यस अगर है तो वाई टाइप कर दीजिएगा, नो अगर है तो एन टाइप कर दीजिएगा, दैट विल बी मोर इजी। सो वंस अगेन आई विल रिक्वेस्ट टू ऑल ऑफ यू कि आप लोग शेयर करें, अपने टीममेट्स को बुलाए, अपने टीममेट्स को फिर से एक बार उनको फाइनल कॉल दे दे कि यस वी आर गोइंग टू स्टार्ट, सो दैट दे कैन ज्वाइन, दे जल्दी जल्दी ज्वाइन कर ले और हम लोग सेशन को स्टार्ट करें। सो हम लोग रुकने वाले नहीं है। अक्टूबर मंथ इज अ वेरी वेरी इम्पोर्टेंट मंथ है। एक ऐसा मंथ जिसको हम लोग हमेशा सेलिब्रेट करते हैं एज अ पिंक अक्टूबर। पिंक अक्टूबर इसीलिए क्योंकि इन 1958 यूएस में एक बहुत बड़ा इनिशिएटिव स्टार्ट हुआ, जो इनिशिएटिव लीड करता है कि ब्रेस्ट कैंसर, जो कि एक बहुत ही खतरनाक तरीके से एक्सपांड होने वाला है, या तो आप देख सकते हो आज के डेट पे ब्रेस्ट कैंसर इनिशिएटिव के हिसाब से इसे शुरू किया गया था यूनाइटेड स्टेट्स में। और इसे माना गया था पिंक अक्टूबर, जो 20 अक्टूबर को हम लोग सेलिब्रेट करते हैं। ठीक है, नाउ इसके साथ जुड़ा हुआ है ब्रेस्ट कैंसर अवेयरनेस, जो कि आज के डेट पे अगर आप देखोगे, इन नॉट ओनली इन इंडिया बट पूरे वर्ल्ड में ये एक बहुत ही बड़ा एक एक ऐसा बन चुका है जहाँ पे पूरे वर्ल्ड में ब्रेस्ट कैंसर हैज बिकम वन ऑफ द बिगेस्ट 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 डिसीज। और इसमें से नुकसान बहुत सारे विमेंस को हो रहा है, और बहुत सारे डेथ रेट है, मोर्टेलिटी बहुत ज्यादा है। और इससे बचने का एक ही तरीका है, वो है आपकी अवेयरनेस। आप जितना ज्यादा अवेयर रहोगे, जितना ज्यादा आप यंग एज से अपने आप को सावधान रखोगे, उतना ज्यादा आप इससे बच पाओगे। ठीक है, तो फिर ये जो अक्टूबर मंथ है, जो पिंक अक्टूबर बोल के हम लोग सेलिब्रेट करते हैं, और हम लोग हमेशा वेयर करते हैं पिंक में, क्या करते हैं, दिस पिंक रिबन, दिस इज द सिंबल ऑफ ब्रेस्ट कैंसर अवेयरनेस प्रोग्राम, जिसको डेडिकेट किया गया है जो लोग फाइट कर रहे हैं विद ब्रेस्ट कैंसर, जो लोग ऑलरेडी सरवाइव कर चुके हैं उनके लिए, और जो लोग डिसीज्ड है विद ब्रेस्ट कैंसर, तो उनके उनके फ्रीडम, उनके उनके स्पिरिट के लिए ये पिंक अक्टूबर हम लोग सेलिब्रेट करते हैं। ठीक है, तो आज का जो सेशन है आप लोग अच्छे से अटेंड करिए विथ योर पेन पेपर, ओके, डायरीज नोटपैड आप सभी लोग रेडी कर लो, और अच्छे से आप इस सेशन को अटेंड करो, सो डैट इसको आप और ज्यादा मल्टीप्लीकेशन कर सको, और ज्यादा डुप्लीकेशन कर सको। ठीक है, सो थैंक यू सो मच, एंड विथ योर ऑल सपोर्ट आई वुड लाइक टू वेलकम आर टुडेज चीफ स्पीकर, आवर गेस्ट स्पीकर, हमारे सबके फेवरेट मिस्टर वाईटी सर। वेलकम सर, वेलकम ऑन द सेशन, वेलकम सर, वेलकम, वेरी वेरी वेलकम टू आवर सेशन। Over to you.
Thank you, Pranab. Thank you very much for the for the invitations for this very unique, very special, and very meaningful seminar. And this is a right month to organize the right seminar like this. Okay, so namaskar, Indian. Right, long time never been there. You miss me. I miss you guys very much. Was planning to have a trip maybe in the beginning of December, and we are still working out with Kelvin Z and Vikas Z. So hopefully I can make the trip in the December, and have a road trip to meet all of you. Okay, so I believe the weather is getting cooler, especially in Delhi. I'm now in Islamabad. I see I'm wearing a sweater, and it's quite a jacket. It's quite a thick jacket, because the temperature here is quite low. In the afternoon, only 18 Celsius. 18 degrees Celsius. Then at night only 15 degrees Celsius, something like that. All right, so everything is good, everything is fine here. So today we are going to conduct a seminar for the breast cancer. All right, so allow me to share my PPT. Okay, as Mr. Prana has mentioned about the about this month, this is a very meaningful month, which is the breast cancer awareness month, right? WHO already fixed the month as this breast cancer awareness month, mainly because of the breast cancer cases are rising year by year. Every year we are having rising on this breast cancer case, and the modality of breast cancer also quite in a high level. All right. So in averaging about 30% of the womb of breast cancer patients will die, right? And I have some statistics later I will show to you, which is for India's statistic and prepared by Mr. Pranab. Thank you very much. And also showing that the in India is having higher mortality rate of this of breast cancer. Okay, so this is a very important. Hold on, sorry, my bad. Okay, this is a very important sessions, especially for women. If you have friends, have women friends or girlfriends, your wife, your family members are women, females, you should invite them to this very meaningful, very important topic, because breast cancer is really dangerous. All right, really dangerous, and every woman has double chance. Why? Because we have two breasts, right? So we have double chance. Okay, so let's go into this topic. And okay, so in India, the incidence rate of cancer keep increasing each year. As I say, year by year. In India, the incidence rates of cancer is increasing year by year. So for the top three cancer, namely it is a female breast, which is a breast cancer. And this is and another one is a cervix, uterine, and ovary cancer. These three cancer are the woman cancer. You see, the woman cancer is very the productive system problem is quite important in this day, right? Because you can see the breast cancer, the cervix cancer, the ovary cancer are only for women. I cannot say only for women. The breast cancer, men may get breast cancer, but this is in very rare case. Mostly are women. Okay, 90% are women, right? And cervix, uterine cancer, ovary cancer, and these two only belongs to women, right? So women is actually having a higher risk of cancer rate. Okay, so as a woman, we really have to take care of our own body, right? And because we are very important, women, we are very important. We have to carry the baby for 9 months to 10 months. We born the baby, we have to take care of the family. Some not only have to take care of family, also have to take care of the business, take care of the jobs, right? And that's many issues will happen on women. So women is they really women appreciated. Woman is I would say really very is greatest, right? So, but also the women are easily to have some health disorder, like this breast cancer, cervix cancer, ovary cancer, and some other diseases. Some other diseases like this, and women are having highest incidence on autoimmune attack as well. Right, you will see in our clinical study, in our practice, that we found that women are having higher numbers of autoimmune and higher numbers of infection disease. Okay, so women is really need to be take care. Okay. Then this is the statistic of India. All right, at all age, women at all age, the major cancer is breast cancer, Okay, so the breast cancer is about 27.7%, and the cervical cancer is 16.5%. Ovarian cancer will go to the 6.2%. You can see the half of the cancers for women, half of the cancers are the reproductive cancer. The rest are the stomach, lung, this colon cancer, or lip, or oral cavity, and some others cancer, right? So you can see the productive system cancer is occupying half of the ratio, right? We have a 50%, about 50% is breast, this is a productive cancer, and the major one is this breast cancer. Okay, so breast cancer is really a hot topic. It's really a very important topic for every ladies. Okay, so if ladies, you are and not only ladies, men, right? You have the obligation to protect the ladies. So you need to take care of your wife, your husband, your family, of your mother's health as well. Okay, so be careful. Breast cancer is quite deadly. All right, it's quite deadly. So in India, 1 in 8 women, all right, 1 in 8 women will develop invasive breast cancer during her lifetime. 1 in 8 women in India will develop invasive breast cancer during her life. What is invasive breast cancer? Which is it can go deep into your tissue, and it is migrationable, which is transferable. It will migrate to some other parts, which is a quite serious, quite severe, quite deadly cancer. Okay, and but you see, 1 in 8 women will develop the breast cancer, but you can see there's 43% of the diagnosis will only diagnose at the late stage, which is stage 3 and stage 4. Okay, when you are entering into stage 3, which means the cancer cells is quite big already, and it is preparing to migrate. Okay, at stage 4, which means the cancer cell already migrated to some other parts. Okay, so the definition of the stage, breast cancer stage, you can go online and check. There's a lot of information. We are not going to mention here anymore. And you can see, because due to the late diagnosis, the 5-year surviving rates in India only up to 52%, slightly more than Malaysia. Right, Malaysia has a lower, which is 49%. But India is only 3% more than Malaysian. Okay, and India is having huge populations, right? So 52%. You can imagine what is the seriousness of this disease. 1 of the 8 women will develop the breast cancer, and 52% of them, half of them in 5 years can survive. They only in 5 years surviving, only 4 of them, only half of them can be survived. Okay, so the diagnosis is very important. Body checkup is very, very important. We have to do the body checkup yearly. Okay, as I always emphasize that if you are aged after already more than for age 40 and above, age 50, something like that, age 40 and above, you have to do the test every year. You have to perform the body checkup every year, because after age 40, many diseases is coming. Okay, many diseases is coming. So we need to keep monitoring our body, keep monitoring our health, to maintain a good health, in order to have a quality life, right? Okay, we can earn a lot of money. Maybe someone will put the quality life equal to how much they are earning. Right? You can earn 10 lakhs a month. You can earn 100 lakhs a month, right? But without the health, you are nothing. Okay, the money is nothing. Because we cannot bring the money to the coffin. After we pass away, right? Everything will back to zero. We're down to the will become the dust. Okay, so if you want to enjoy the life, if you want to have a quality life, we have to keep monitoring our health status and do a proper preventive actions. Okay. And a few more statistics, and you can see the breast cancer. Okay, as just now you can see the breast cancer, most common cancer in India, 27.7% of all new cases. And in 2018, breast cancer, every 4 minutes will be one woman in India is diagnosed with breast cancer. So every 4 minutes, and every 8 minutes will be one woman die of this breast cancer. See, every 8 minutes and every 4 minutes diagnosed one, every 8 minutes will one will die, which means every 2 diagnosed, one will die. Okay, every 2 diagnosed, one will die. So an estimated as 162,000 women newly detected with breast cancer in India in year 2018. Okay, and 87,000 of them die. 87,000 of women die of breast cancer in India for the same year. Okay, so also half, 50%. All right. So this is the second highest in the world of this year, of that year. Okay, in 2013. And on average, woman averaging women wait more than 3 months. Okay, averaging women will wait more than 3 months before presenting themselves for a checkup. So when they starting to have some symptoms, when they are having some symptoms, they are feeling some abnormal on the breast, all right, then usually women will wait a certain period, wait until 3 months later, some are 4 months later, some never do the checkup. So in averaging, they wait until 3 months later. Okay, 3 months later. So please bear in mind, we take a very long time to develop a cancer disease. We take a very long time. You may take 20 years, 30 years to develop a cancer disease. But once you are entering to the cancer disease, from stage 1 to stage 4, it can be as shorter as 3 months to 6 months. It can be as shorter as 3 months to 6 months. So if you waited 3 months only to do the diagnosis, of course, many will have the diagnosis. We found the problem at the very late stage. Okay, so don't wait until 3 months or 6 months. When you found something, feel something different, feel something abnormal, please go for a checkup. Okay, the breast checkup, we have this, a mammogram checkup, we have some invasive checkup also as well. So all these can be done, right? So don't wait when you are having these when you are having some abnormal symptoms or abnormal situation, feelings. All right, and so all these are the data, and according to estimations, at least 17 lakhs people, 17 lakhs women in India may have breast cancer by 2020. See, estimated 162,000 newly detected. This is detected, okay, and this is for those who are not detected. It's not in this figure. So by estimation, okay, at least 17 lakhs of women in India may have breast cancer by 2020. All right, so this is I would say this is a very scary information data, right? We need to be aware. We need to be aware. Okay, and of course this is the, now as you can see, just check the right side, the right check. The right picture, and you can see the estimated breast cancer case per 1 lakh women in 2020. Okay, southern part is quite serious. So for women from southern part, you are having a higher risk. All right, and this part northern part also having some risk. So southern part and northern part have to be aware. All right. So, and what about the age, the incident age? Some youngster they may say that don't worry, I'm still young. I may not develop breast cancer easily. Some age 30, 40 ladies, they will think, yeah, it's quite young. Age 30 and 40 is quite young. But you can see the comparison. You can see the comparison 20 years back and present. Okay, 20 years back and present. At 20 years back, most of the breast cancer case happening, the high peak is at 50 to 60 or 60 plus. Okay, after age 50, mainly after menopause, they will develop the breast cancer case is more obvious. Okay, but in prison you can see that the breast cancer case from age 30 above is more we're having higher rate at this age 30 to 40 and age 40 to 50 compared to 20 years back, 20 years ago. Okay, so what is this information telling? Actually, this chart is telling us that the breast cancer is having more cases on younger women. They are having more cases on younger women. So this is no longer the old age women's privilege. This is they already pushed to the younger generation, younger women. So be aware, women from age 30 and above, you're already having the risk to develop breast cancer. Okay, so breast cancer become happening on young ladies is no longer news. All right, it's quite common right now. I have a friend was diagnosed as a breast cancer, a lady diagnosed as a breast cancer at age 29. All right, and then she removed one breast. So to her, this I would say she's quite sad on that, but no choice. She has to remove. But then the great news is she's surviving. All right, she's surviving. So, and this is how we do the diagnosis. We have a few type of diagnosis, and mammogram is a very common diagnosis method. All right. So how the mammogram? If lady, you ever done this mammogram test before, then you will know that the painful, right? Because you have to put your breast on the platform, and then the machine have to press your breast. And it's very painful. I never experienced that, but I know that it's quite painful because it has to press until it cannot press anymore. So it's quite painful because they have to do the scan. If density is not there, they cannot diagnose correctly. Okay, so they have to press the breast. Now we have some new technology is not that common yet. The new technology is one handheld machine, just press on the breast, move on your breast, just like a mouse, using a mouse to moving on top of your breast. They also can do the diagnosis. All right, but still mammogram is a most reliable method to diagnose breast cancer. Okay, so and this is only for women who are having a certain size of breast. If woman is having a small size of breast, they may have difficulty on to perform this test as well. Okay, so and of course online we have a lot of you can go online, check. There's a lot of self-examinations of breast cancer, how to examine your breast. All right, all this you can learn from online, or you can go for YouTube. Okay. So you can see this is a common breast cancer. When you are when you are having breast cancer, the breast may become this kind of situations. Okay, may become this kind of situation. The breast or your nipple you will feel pain. You will have this nipple retraction. nipple discharge, okay, change to the texture, orange peel skin, just like this, orange peel skin, and hard lump, you will feel some lump and feel there is a hardness, and the whole breast become redness, dimple, new size shape. All these are the abnormal symptoms, abnormal signs of the breast cancer of your breast. Okay, if you ever experience one of the situation, better to perform the test. Okay, but if you are having if you're only having nipple discharge, like but it's not the blood, it's some like milk, discharge some milk or something like that, that maybe you are pregnant, okay, or maybe you are having high prolactin, right? Women will have high prolactin. Sometimes some situation will induce your prolactin secretion. Okay, and when you are having high prolactin secretions, you may experience some symptoms like having breast having milk discharge, but you are not pregnant, but you are having milk discharge. Okay, some milk will leak out, something like that. So this is a high prolactin symptoms, and of course, with if you are having high prolactin as well, the menstrual will not be stable. You may have mass menstrual. Okay, mass menstrual. Your menstrual will drag maybe 2 months, 3 months, only come once. Okay. So this is a hyperacting, right? But if you are even experience one or two abnormal situation in this chart, then the best is to perform a test, okay, to ensure that your breast situations. Okay, this is a common breast cancer treatments. You see, as usually that if you go for mainstream, usually you have to go for surgery or radiations or medications, right? So usually you have to perform a surgery or some invasive test. They have to take out some tissue to perform the test. But bear in mind, sometimes when you disturb the tissue, when you do the invasive test, you remove some part of the tissue to perform the test. At that time, you may trigger the migrations of the breast cancer. Okay, so this is why some issues that after they done the breast cancer examination by this invasive test, they take out some tissue and then they do the test, and after that the breast cancer spread to some other organs rapidly or immediately. Okay, so this could be happen, but not all, of course, not all. So usually you can go for the surgery, removing some parts of the bad tissues, or even remove the whole breast. Okay, so this is a surgery. Some doctor may advise you that or may scare you. Okay, not all, some only, that you can remove both breasts, even the another breast is still okay, because to mainstream is of course removing the breast, you won't have breast cancer. Okay, this is a common common thinking. Of course, I know, remove the breast, we won't have breast cancer. Remove our head, we don't have brain cancer as well. Okay, all right. If remove our heart, we don't have heart attack. Okay, so then we may perform some, we may have to go through some radiation control, radiation therapies, chemotherapies, okay, to further ensure the cancer cells is eliminated in the body, okay, is killed in the body. But when we go through the radiation therapies, at the same time, the chemotherapy will also kill not only killing the cancer cells, but also killing the normal cells. So people who are experiencing this chemotherapy, they are having a weak situation, weak body, low immunity. They were having low oxygen in the body, because the injection of the chemotherapy okay, the chemotherapy, the toxin will go through, we will travel by this blood vessel. So then it will kill the white blood cells, it will kill the red blood cell as well. So some good tissue, some good cell will be killed at the same time if we performing this if you are performing this chemotherapy. And so actually radiation therapy, which is the chemotherapy, is I would say is making the body worse than before you do that. Okay, but somehow we have no choice. Somehow we have no choice. In order to kill the cancer cells, right? Sometimes we have to use this chemotherapy to help us to remove the thing rapidly. Then after that, we can use nutrients, we can use our lifestyle changing, use our dietary changing to slowly to heal our body, to bring our body back to the good situations. Okay. And some not that severe case can be monitored, can be controlled by medications. Okay, not that severe breast cancer, especially at the stage 1. Okay, and all these are actually can be managed by medication. Okay, so the only thing is you need to find out, you need to diagnose as early as the best. Okay, if you are diagnosed at the late stage, definitely the case will be more complicated, especially if the breast cancer cell has been spread, has been migrated to some other organs. All right. So of course, beside the mainstream, we do have this complementary way, right? Some complementary way to do this treatments. All right. So like we always mention that the golden triangle of health. If you are at the breast cancer stage 1, you can use the complementary way. You can practice the golden triangle of health in conjunction as this adjunctive way. Work together with the medications. Okay, work together with the medication. So we are not if the doctor prescribe you anything, any medication, please do not stop that. All right, you have to go through everything. We have to stick to what doctor has prescribed to me, because breast cancer is quite serious. We have to work hand with hand with mainstream. Okay, but with the complementary, with this adjunctive therapy support, right? We can have a better result for our reversing of this breast cancer. Okay, so and this you can see that many famous women are died by breast cancer. So all these, I don't know them, but you may know them, right? Sonali Bandra, Mahima Chowdhury, Tahira Kashyap, Gautami Kadimara. I think all these are quite famous women in India, and all these are died by this breast cancer. And I think some are survivor. I'm sorry. These are survivor. Some are survivor. Okay, okay, all these are survivor. Okay, I was thinking to have some victim of this, some victim of this breast cancer. But of course they are victim of the breast cancer, but they are survivor only. All right. So as a female, you can see what is the risk of having this breast cancer. First of all, of course, the female are in the high risk, way high risk than a man. Okay, female. So female, you are having very high risk on breast cancer. And if you are having family history, people who are having family history will experience higher risk of breast cancer as well. So as I say, sometimes it's not the family history. Maybe maybe it's this dining table gene. As I always say, always mention, it's not because of the gene. Maybe it's not because of the gene, but maybe it's because of the dining table gene. Because when since you are young, you are taking the same food with a family. What your parents eating, you are following, right? So if the parents is having the diseases, sometimes the kids the kids will have a higher chance to develop the same diseases, just like diabetic, right? Because we are eating the same thing. We are sitting at the same dining table, eating the same thing, right? So sometimes it's not the gene issue. Sometimes it's the dining tables issue, dining table gene issue. Okay. So for ladies, for girls who are having this menarche before the age of 12, what is menarche? Menarche, which is the first menstrual, okay, first menstrual before the age of 12, then you are having a higher risk of this breast cancer, because most of the breast cancer are hormones inducing hormones related inducing cancer. Okay, most of the breast cancer is related to the hormone imbalance. Okay, so if you are having menarche before the age of 12, you will experience that, because with more more estrogen in the body, the more estrogen in the body, the highest chance that you will experience you will get this breast cancer. Okay, and women also having menopause, right? Menopause woman, and without this hormone support, women are also getting this breast cancer easily. And high density breast fibroglandular, so which is put in a simple way, if you are having a bigger size, then you are having a bigger chance. Okay, so some improper diet, this is what we always say. People with obesity, women with obesity, also having a highest chance of to develop the breast cancer due to these inflammations, due to chronic inflammations, due to the oxidative stress and everything, and hormone imbalance. As you should know that obesity, women easily develop this PCOS symptom. Okay, so, and of course, as well as this breast cancer. And people who are taking hormones drugs, environmental hormones. What is environmental hormones? Environmental hormones, which means something like when we're taking chickens, and the chicken meat is contain a lot of growth hormone, because if in normal way, when we grow a chicken by natural way, the chicken will take maybe 1 to 2 months, maybe take 2 months time to grow to the certain size that only can eat. But for commercial chickens, they have to be rapid. They have to grow rapidly, because we cannot feed them and wait until 2 months, then only slaughter the chicken. Okay, so so they will do the injection. They will feed the chicken by the food with contain environmental hormone, which is a growth hormones, and some antibiotics. Okay, to prevent the bird flu, to prevent the disease. Okay, so and then we take the chicken, KFC, McDonald's, or chickens are contain environmental hormone. So if possible, less KFC, less McDonald's is the best. Okay, if you want to take chicken, please raise chicken by yourself, by natural way. Okay, by natural way, and don't feed them by corns. If you feed them by corn, you are creating another problem. The chicken meat will contain high omega-6. All right, so if you are taking too much chicken, you are actually having high omega-6 as well. And then you have to intake a lot of omega-3 to neutralize the omega-6 in order to lower down the inflammations. Okay, so that's why taking omega-3 is very important for to reduce the inflammations. All right, okay, and hormone drug. What is hormone drugs? People are using hormone drugs, like especially menopause women, or some ovaries removal women. they have to depend on these hormone drugs because they are no longer producing the estrogen and progesterone. All right, and these two is woman is quite relying on these two hormones for a healthy life. So some women, when they are having menopause without the estrogen and progesterone, they will have experienced the post-menopause issue. So skin rushing or when they are during menopause, they are having this issue. So some countries, they allow this hormone replacement therapy, okay, which is you can use a man-made or this man-made hormones, man-made estrogen, man-made progesterone, the cream or some pills, right, to take that to reduce the symptoms, okay. But all these are not natural. All these are synthesis hormones. Okay, and all these are actually causing you accumulate too much of estrogen, especially the estradiol, which is estrogen 2. Estrogen 2 is harmful. Okay, estrogen 2 in the body, in your body. When you are having excessive of estradiol, which is this estrogen 2, then this estrogen 2 will induce the this breast cancer happening. All right, so most of the breast cancer are related to excessive of estrogen in the body. Okay, and of course, alcohol, tobacco, drugs, women with no breastfeeding, all right, and women with no having no child or in this advanced maternal age also may have a highest chance of develop this breast cancer. Okay, so please aware if you are having some points on here, right, in this chart, you may have just do the test if possible. So what will make us to have this breast cancer? Of course, the first, as I say just now, what I say is this is a hormone-induced breast cancer. Okay, but for most of the cancer are related to, I mean, for the cancer, mostly are related to the cells damage. All right. So why the cell is damaging? You see, the cancer cells are transformed, are mutated from normal cells. Cancer cells are not mutated from normal cells. When the normal cell is nearby, if a cancer cells, but sorry, if a normal cell is not healthy, so it may be mutated to be cancer cells. Okay, to be a cancer cell. So one of the reasons to make the cells become cancer cells is the free radical attack. Okay, as we say that free radical is a free radical attack is kind of this oxidative stress. Okay, so with this oxidative stress, it will cause a lot of inflammation. Then the inflammation will induce all the cancer risk, will increase all the cancer risk. So free radical attack always one of the reason of this cancer happening. All right, because the cancer cells are mutated cells, and mutated cells are DNA damaged cells, and DNA will damage because mostly caused by free radical attack. Okay, so reduce the free radical attack is very important. By the way, to reduce how to reduce the free radical attack, beside to practicing this the dietary, to practice the golden triangle of health. For the supplement wise, you should take more OPC, you should take more this green tea extract, you should take more zinc. Yeah, because all these are the very good antioxidants. Okay, so take antioxidants, take anti-inflammation supplements. It will help you to reduce the free radical attack. Of course, you have to stay away from tobacco. You have to stay away from alcohol. You have to stay away from all the bad food, junk food, everything. Okay. And for breast cancer, usually for breast cancer, as I say, usually are the estrogen dominant cancer. Okay, breast cancer is usually estrogen dominance, estrogen inducing cancer. Okay, so if you are having this estrogen dominance, how do you know you are in estrogen dominance? You can observe yourself if you are having this worsening PMS, premenstrual symptoms, pain lah, fainted lah, uncomfortable. If you're having worsening premenstrual symptoms, you may be the estrogen dominance. Okay, which means estrogen dominance, which means you are having too much of estrogen, excessive of estrogen in the body, right? So if you're experiencing this worsening PMS, you may be in this estrogen dominance. And if you're having low libido, which means you are having low sex drive, you may having this estrogen dominance. Okay, and if you are having fertility issues, which means you are hardly to get to pregnant. Okay, you are hardly to pregnant. Then this you may be also in this estrogen dominance. And ovarian cysts, okay, heavy period, cellulite, fluid retention, which is edema. Okay, and endometriosis, fibrosis, lumpy, painful, or swollen breast, weight gain, particularly around the hips, all these are the estrogen dominance. Okay, so you can observe by yourself if you're having one or two of the symptoms. Yeah, you may be in the case. So when you are in this estrogen dominance, usually the breast cells are only having this protein receptor. But once you are in this estrogen dominance, the estrogen hormones receptor will stick to the cells also. Okay, too much will stick to the cells, and then this will cause the cells mutations as well. This will cause a cell mutation, and also causing and plus the free radical attack, the mutation will be faster. Okay, this is why the breast cancer is always I would say it's always grow faster. Okay, grow faster than some others organs. So the cause of estrogen dominance, same story, right? Same story. Obesity. Definitely, women with obesity will have this estrogen dominance. If you are so stressful, people with in long-term high stress, it will cause them to have abnormal secretions of this cortisol. So it will cause you with this hypercortisolemia, and lately it will bring you into these cortisol deficiencies, which is adrenal fatigue. Both will cause the hormone imbalance. So people who are always in high stress, usually they will have more ants, they will have hot tempers and everything. All these are causing by hormones imbalance. So in Chinese, we always said a woman. We always say a woman, when we saw a woman, they are in furious, we will say that, you see, hormone imbalance. She's in hormone imbalance. Okay, so this is although this is a joke, but the relationship is there. Okay, so stress will induce estrogen dominance, and people who are drinking alcohol also will induce the estrogen dominance. And guts dysbiosis, which is your guts, the colon, your guts is not healthy, the intestinal is not healthy, all these germs are not there, the probiotic is not sufficient. The probiotic is not sufficient there, so it may also induce of this estrogen dominance. And some medications like the hormone drugs, and people are using the synthetic xenoestrogens, which is the cream, the estrogen cream, and something like that. Okay, all this will cause you are having this estrogen dominance. Of course, the food are very important. What we eat also causing the estrogen dominance. So we already understand the breast cancer, and of course, what can we do? Yes, preventive action is always the important. Please don't wait until you have the breast cancer, only think of the solutions. Okay, think before you get the disease. Prevention is always important than treatment. Okay, don't go for treatment. You have no idea if you never experienced some major disease. You have no idea what is the pain and everything. Okay. So in Tiens, of course, we do have these breast cancer preventive agents. All right. And today I'm mainly to introduce you to very important these breast cancer preventive agents, which is available in India, and especially OPC only available in India. And this is a very good agents, very good supplements. Okay, let's go for that. So the first thing I would like to introduce you is the grapeseed extract. What is grapeseed extract? Of course, grapeseed extract is those things extract from the grapeseed. All right. So grapeseed extract are rich in antioxidants, okay, including this phenolic acid, these are anthocyanins and flavonoids and oligomeric proanthocyanidins complex, which is this OPC. And all these are very good antioxidants, especially OPC. Okay, and OPC grapeseed extract is actually equal to OPC already. When we're talking about grapeseed extract, we are talking about OPC. Okay, because grapeseed extract is reaching in this OPC, the richest in this in OPC. Okay, so due to the high antioxidant content, grapeseed extract can help prevent disease and protect against oxidative stress, tissue damage, and inflammations. So all these cancer cells, everything are due to the cells damage, the oxidations and inflammations. All right, so grapeseed extract definitely is a very important preventive agent for the breast cancer. And what you can see, the 10 benefit of grapeseed extract based on science. All these are based on science, and you can see that the 10 very good benefit of grapeseed extract. The first thing, of course, is reduce oxidative damage, and it can reduce the blood pressure as well, improve the blood flow, improve collagen level and bone strength, supports your brains as it ages. Okay, and number 6, we can see that you can also improve the kidney function, inhibit infectious growth, reduce cancer risk, protect your liver, and enhance wound healing and appearance as well. Okay, so for OPC, is having a very good, very broad usage, very broad functions in order to manage to maintain your health. This is why everyone come and ask me, especially our Indian members, come and ask me, so what kind of supplements we have to advise to our customer, right? I will always advise the antioxidant to them, and especially OPC. You can see whatever you ask me, I will always tell you take OPC. This is a must. Always OPC the must, right? And plus some others nutrients. So OPC is a very good antioxidants, very good cancer preventive agent. Okay, so what is the function? What is the function in preventive this breast cancer? So you can see OPC is having all these are from the study. According OPC study against the breast cancer, there is a lot of paper already published. You can simply log on to this PubMed, or you just go check online. You just check online. You check grapeseed extract and breast cancer. You will get a lot of studies. So I just extract some of them and do some conclusion on them. So all these are showing that OPC is having a very good function in against this breast cancer. So the first point, OPC have demonstrated the anti-proliferative effect and cytotoxic effect. Anti-proliferative effect, which means it can inhibit the duplication, the multiplication of the cancer cells. So we call it anti-proliferative effect. And cytotoxic effect, which is to make the cancer cell die. Okay, so OPC have demonstrated these two very strong effects, okay, on selected cancer cells, which including breast cancer, okay, including breast cancer cells. And several studies has consistently shown that grapeseed extract inhibit the formation of cancer stem cells in breast and colon cancer. See, right? The grapeseed extract will inhibit the formation of cancer cells, especially these breast cancer and colon cancer. And grapeseed extracts suppress the breast cancer cells migration and invasive. So if we are already having this, having the breast cancer at this moment, take the OPC. Take OPC because OPC may help you to prevent or to slow down this breast cancer cell migration and invasions. Okay, so take that, and last one is the grapeseed extract is potentially useful in the prevention and treatment of hormone-dependent breast cancer. As I say, the estrogens dominance breast cancer. Okay, through the inhibition of aromatase activity. Okay, what is aromatase? Aromatase is a kind of enzyme that it will convert the testosterone to estrogen. Okay, and aromatase is usually high in the tissue. It's usually abnormally high in the tissue, in the breast tissue, in breast cancer women. Okay. So the result, the study has found that grapeseed extract can inhibit the aromatase inactivity, then those to prevent or to treat the hormone-dependent breast cancer. So OPC is very important for breast cancer or even for some other cancer. All right. So you are not having breast cancer, but you are having some other cancer, or you have family or friends experiencing cancer disease, please advise them to take OPC. This is very important. Okay, OPC is very important. And what about zinc? Zinc is an essential nutrient, and most of us are experiencing these zinc deficiencies. We are experiencing zinc deficiencies, especially in developing countries, right? So the World Health Organization, WHO, already mentioned that this is zinc deficiency is a major disease contributing factor. Okay, so most of us are lacking of zinc deficiency. In India, RDA of zinc, it only allows 17 mg, 17 milligram. So please bear in mind, please be aware, are designed for 18 years old young adult with no disease, with a healthy. They are using 18 years old young adult without any disease. They presume a young adult 18 years old without any disease, they're healthy young adult. They only need 17 mg of zinc. But are you the young adult right now? Most of us are not the young adult, and most of us are not healthy at all, right? So definitely we cannot rely on RDA. RDA is not for everyone, okay? The advice, the RDA is not the recommended dosage is not for everyone. That one is only for 18 years old young adult and without any disease, young healthy adult. Okay, so we are not healthy young adult. Definitely we need more. We need higher dosage of zinc. This is why by following the RDA, most of us are having zinc deficiencies, and this is a problem. Right? Zinc and iron is in our brain. If we have we have less zinc, then we may have more iron in the body. The zinc and iron ratio will be unbalanced in our brain. Then the iron will cause some oxidative problem. Okay, because iron is the highest oxidative agent in highest oxidative minerals in the body. So if we have too much iron in the body, it may cause more oxidative stress in the body. If you have too much iron in the brain, then it will cause some problem for your brains. So people are having Alzheimer. People are having this anxiety. Anxiety is a mental disorder. Okay, people are having this Parkinson's. It may be because of the zinc and iron imbalance in the brain. Okay, so zinc is a very good antioxidant. So iron is a very strong and oxidative agent. So zinc have to balance with the iron. Zinc level has to balance with the ions, okay, in order to reduce oxidations. Okay, so we are zinc deficiency. So based on science, okay, we have some benefits of zinc. So like as I say, zinc is more than 300 these enzymatic reactions cofactors. Okay, so we need zinc, right? Every part needs zinc. So for your gene expressions, enzymatic reaction, immune functions, immune function needs zinc, right? So in order to build out your zinc, your immunity, you need zinc. And protein synthesis also we need zinc. DNA synthesis we need zinc. The wound healing you need zinc. Growth and development we need zinc. Hormones balancing also needs zinc. Okay, and all the glands from pituitary, thyroid, thymus, your liver, your kidney, your pancreas, your ovaries, your prostate, all need zinc. All right, all need zinc. All very depending. They are very depending on zinc. Okay, so that's why for women, if you want to have maintain a good productive system, then you need to take zinc. And for men, if you want to build up, to be like a man, to roar like a lion, then you need zinc as well. Okay, for people who are having this fertility issue, right? Cannot the sperm is not that healthy, or the egg is not that healthy. You definitely have to take zinc, because the ovaries and the prostate need zinc badly. Okay, people who are having diabetes, okay, you need zinc as well, because the major form of insulin stored in your pancreas have to bind with zinc. Okay, so zinc is everywhere. Zinc, you need it everywhere in the body, right? So this is the second greatest mineral in the body. So we are not allowed it to be deficient. Okay, so zinc, and what can zinc to do with breast cancer? So again, from a lot of study, we can found that the zinc is an important trace element. Okay, enzymatic, metabolic, and cellular process in the human body. Okay, and so you can see abnormal zinc homeostasis can lead to the onset and progression of various diseases, including breast cancer. So the homeostasis between the zinc unbalance, the zinc deficiencies in the body may lead you to the various diseases. So including the breast cancer, all right, because the metabolism is not there, the immunity also not there. Okay, and you can see the high serum zinc level reduce breast cancer risk. High serum zinc level reduce breast cancer risk. All these are from the very reliable, highly reliable studies. A meta-analysis provide evidence that hair zinc levels in female breast cancer patients are lower than in control. Okay, what does that mean? What is meta-analysis? Meta-analysis is we bring all the related study together, and then we sort it out. Some we eliminated, some are not reliable, we eliminated. We keep those highly related information and do the analysis on this, on all these paper. So we call it meta-analysis. The result is very reliable. It's highly is very strong. Okay. So which means the evidence proof that the zinc level in female breast cancer patients are usually lower than in control. In control, which means they are not having breast cancer. People who are having breast cancer, the zinc level usually lower than the normal people. Okay, so to prevent the breast cancer or some other cancer, we have to maintain a good zinc level in our body. All right, and the last thing is there is a significant relationship between lower zinc, serum zinc, which means the zinc in your bloodstream, concentrations and risk of breast cancer onset or recurrence in women. Which means if you're having low low zinc in your bloodstream, then you will have higher risk to have the recurrence of breast cancer if you have breast cancer before, right? And now you're having low zinc, you are having higher chance to have the recurrence breast cancer. The breast cancer will come back. You have higher chance to have this breast cancer to come back. All right. Okay. So this is the zinc to the thing. So to prevent the zinc, to prevent breast cancer, I will highly recommend you to take our OPC and the zinc together. You must take these two agents. The rest, maybe you will say that I'm not temporarily. I just want to have a less the minimum nutrients to help me to prevent or to reverse the breast cancer. Okay, so if you want to go for the minimum, I would say these two will be the minimum. Go for OPC and go for zinc. Go for OPC and go for zinc. All right, but if you think you can go for maximum, definitely we have some others to introduce to you, like this omega-3, omega-3, like this green tea extract. Okay, even spirulina, multivitamin, all these are quite useful to help you to prevent the breast cancer. Okay, if you are already experiencing or already in the troubles in the disease of breast cancer, okay, you should take more than the daily recommended dosage. Okay, you should take more than daily recommended dosage. Okay, so this is my advice to you. All right. Okay, so this is end of today seminar, end of my presentation of today. Thank you very much. And before we end the sessions, maybe we can have some we can have some discussion. Any question, anything you want to ask, just raise your hand or just turn on your mic. Will do. So thank you very much. I will pass the session to Mr. Pranab. Pranabji, is your time all on yours?
Thank you, sir. Thank you so much for wonderful presentation, and thank you so much for giving us so much insights about this breast cancer and how to fight with this breast cancer. Because as we see, this is the one of the leading disease that is across the globe, and in India and Asia Pacific. If you see, in Asian countries and African countries, this is one of the most, and it is growing very fast. And survival rate is less than 50%. Survival rate is very, very less. And it has been seen that from very younger age, from age of 20 to 40, and this is the age where majority of women actually getting this disease and then getting suffered from this breast cancer. So it is not something which is come at some particular age, or maybe at a later age, or women those who are in a age, if we are 50 or 60 or something like this. But this breast cancer may happen to anyone. It may be our brother, it may be anyone of our sisters, or maybe our wife, or maybe mom or mother, or anyone could be suffer from breast cancer. So the best advice is to help ourselves and help our people to stay healthy and having a better life. So in this regard, if you have any questions, and if you have anything you want to know more about this breast cancer, if you have any questions, then please raise your hands one by one, and we will unmute you one by one, and you can ask your question. Okay. So sir, I have seen so many hand raised, so can I unmute one by one?
Yes, yes, yes. Why not? Please
Okay. So
show the line.
yeah, yes. Thank you so much, sir. So there is a lady, Miss Rani Rai. So ma'am,
Yes.
please unmute yourself.